Rosemary Marchant. I'm a descendant of Dr. JENNIE TROUT. Dr. Trout lived a life of service to others, first as a teacher, then as a physician, often treating patients and giving them medicine for free. And then she, as they already said, gave a substantial donation to found a medical school to train women in Ontario. She was a leader in the temperance movement and in the Association for the Advancement of Women. To meet the requirement of licensing, she had to spend a year at the University of Toronto. But I was told when I was growing up that she sat across the hall from the lecture theatre in another lecture theatre with the doors open because they were afraid as a married woman she'd be a distraction to the men. Jenny Kidd Gowanlock married Edward Trout. He supported her becoming a physician. They had no children of their own. However, her niece had 5 children. That woman, my great-grandmother, and my great-grandfather developed tuberculosis. My great-grandmother died. They did not think that my great-grandfather would survive. However, he survived 3 wives and had 11 children. And I can tell you that growing up, I knew all of those that were still alive. The 5 children then, as a result of their parents dying and being very ill, were adopted by relatives. Aunt Jenny and Uncle Edward adopted the 2 small toddlers that were the youngest children. My grandfather refused at age 7 to be adopted, but he did spend a great deal of time in the Trout household and lived with them when he went to the University of Toronto Medical School. 32 years after Dr. Trout was licensed, my grandfather's 1907 University of Toronto class of 150 had 4 women graduates, although 20 had been admitted. And my mother's 1939 University of Toronto medical class, there were 16 women and a class of 152. In my 1977 Dalhousie University medical class, there were 20 women and a class of 100. The ratio of men to women changed very little in the 70 years between my grandfather's graduation and mine. It's almost 50 years since I graduated and 150 since Dr. Trout became licensed, but there will soon be an equal number of women physicians and men physicians in Canada. Women are at 45% now. Yeah. 150 years since Dr. Trout became licensed to practice medicine and 31 years since this organization started to recognize outstanding physicians. Dr. Trout, who was a modest individual, would be honored by this recognition. Her advocacy for those who could not afford treatment, her missionary work, her financial support of a school to train women physicians were most meaningful to her. I'm honored to witness the installation of Dr. Jennie Trout into the Canadian Medical Hall of Fame. Thank you very much.